I'm Dr. Stream, a board-certified family medicine and sports medicine doctor. If you're dealing with rotator cuff pain, the biggest mistake is resting too much. And the second biggest mistake is doing heavy strengthening too early. So in this video, I'm going to guide you through phase 1 and phase 2 of my rehab protocol. So the goal of the phase 1 and phase 2 is to 1. Calm down the pain and restore the range of motion without irritating the tendon. If you have pain when you try to lift your arm or when you're sleeping at night, this is where you start. So let us start with phase 1. The first exercise is basically to improve thoracic spine mobility. A stiff upper back will cause the shoulder blades to come forward a little bit and thereby pinch the tendon. So it's important to improve the thoracic spine mobility. So the best option would be to use a foam roller, but if you don't have a foam roller, you can start with a rolled up towel. So I'm going to start with a rolled up towel first, and then I'll show you with the foam roller. So you're going to place the towel in such a way that's going to land right in your mid upper back. So I'm going to lie and my head is going to face towards the ceiling. So I'm going to lay in such a way that the towel lands on my mid upper back. So then you can support your head so that you don't strain your neck. So I'm going to support my head and then you go backwards like this. So you feel a good stretch. You're basically opening up the chest and then you're improving your thoracic spine mobility. So I'll hold this for like anywhere between like 3-4 seconds and then come back. So that counts as 1 repetition. Again, same thing. Go all the way and then hold for 1, 2, 3, 4 and then come back. Again, all the way back. Again, 1, 2, 3, 4 and then come back. So remember, not everybody may have, so some people might have stiffness in their upper back and they may be able to go only up to here, and that's fine. Don't force this motion. Let the gravity play its role. All you're trying to do is that you're slowly improving the thoracic spine mobility. But let us say if you can get a foam roller. So it could be either you can start your rehabilitation with towel, or you can probably do the rehabilitation with towel. But let's say if you can get a foam roller, same thing, the foam roller goes right at the mid upper back. But the advantage is that you also can roll as well, and you can actually adjust the foam roller so that you can get a little bit enhanced stretch compared to just using the towel alone. So what I'm going to do, same thing, it's going to land right at my mid upper back. So support with your hands, support your neck and then go back. So 1, 2, 3, 4, 5 and then come back. Again, go back down. 1, 2, 3, 4, 5 and then come back. So now I'll adjust the foam roller so that I'm kind of like moving a little bit, maybe like a centimeter or so, and do the same thing. 1, 2, 3, 4, 5 and then come back. Again, 1, 2, 3, 4, 5 and then come back. And you can roll your upper back as well as you do this exercise with the foam roller. And again, as you've completed 10 repetitions, so I would probably recommend anywhere between 8 to 10 repetitions, then you're done with this exercise. So the next exercise is called as the lying down external rotation with a dowel or something like a stick. Okay, so I have a stick that I was using for martial arts before. You can probably get a broomstick or a mop stick. Any stick will work fine. So what you're trying to do is that you're going to tuck your elbow close to your ribs, so you're not flat out like this, you're close to the ribs like this, and then you're going to push. So basically using this hand, I'm pushing this arm so that this arm goes into external rotation like that, and then same way the other side. So one is pushing the other arm, the other one is pushing this arm. So I'm not pulling it, I'm actually pushing it. So when you're pushing it, you're also enhancing the stretch as well, but don't push too much. Don't push beyond your pain threshold. So for example, if I'm pushing this way and my shoulder starts hurting, I would stop there. And again, if I push this way, if my shoulder starts hurting this here, I would stop there. So your goal is basically to slowly mobilize as you get better. So for example, day 1, you might be here and might be having some pain, but day 5, you might be here, and that's progress. Okay, so the same movement, we're going to do this lying down. So lying down, okay, so my elbows are tucked close to the rib cage like this, and then I'm pushing this way. So 1, and then again 2, again 3, again 4. So I would do anywhere between a total of 10 reps on each side, so basically a total of 20 reps. See, as you can see, as I'm getting better, my shoulder kind of goes all the way into full external rotation there, and then coming back same way, all the way to full external rotation like this, okay? Done? So do this anywhere between 10 to 20 repetitions on each side. So the next exercise is called as the Dowel Scaption. So this exercise, basically, we're trying to lift this shoulder in a 45-degree angle, just like this. So again, we're not doing this, we're not doing this, we're doing somewhere in the middle. So I can use a small stick like this, okay? And then all I'm doing is that my thumbs are pointing up, see, not this, okay? My thumbs are pointing up. So either you can hold a stick like this, or if your stick is like so long, then make sure that your palm is facing towards the ceiling, okay? So I'm going to hold the stick like this. My thumbs are pointing up, so I'm going to lift all the way up to almost like a 90 degree and then come back. Again, one more, lift all the way up. So let's say, for example, like you're lifting up here and then you feel like, my shoulder starts hurting, that's it, you stop there. And then eventually, as you start to get better, you lift, your goal should be getting up to 90 degree here and then come back. Again, when you come here, focus on not shrugging your shoulders. It should be a smooth movement. So let's say if you're shrugging it up, then you're going beyond your pain threshold. So go up here, all the way here, no shrugging, and then come back down, okay? So I would do this exercise anywhere between like 8 to 10 repetitions, okay? So next exercise is called as the isometric external rotation. When you say isometric, it means that we are contracting a muscle, but a joint is not moving. So here, for this exercise, we're going to activate a muscle called as the infraspinatus. For this exercise, you're going to stand close to the wall, and I'm going to place my hand, I'm going to keep my elbows tucked, keep my elbows at 90 degree angle, and I'm going to put my hands onto the wall, and then imagine contracting your muscle 100%, you're trying to really push the wall. For this exercise, we're going to generate anywhere between 20 to 30% intensity. So let us say 100% is this, then I'm going to do 20%. So just a slight contraction, and then I'm going to hold this contraction for anywhere between 20 to 30 seconds. As I'm doing this, you can actually feel that infraspinatus. If you put your finger right in the back of the shoulder, like right here, so that's where your infraspinatus comes and attaches here. So if you put your hand like right here, you can feel that muscle is activated, and then relax. Again, muscle is activated and then relax. So I recommend doing 2 times on each shoulder. So I'll do this, I'll repeat on the other side, and again, I'll repeat on the affected side again. So 2 times on each shoulder, okay? So the next exercise is isometric extension. For this exercise, same thing. Again, it's an isometric exercise. So you're just activating the muscle. So you're going to walk close to the wall, and we're trying to activate our posterior musculature, the posterior deltoid. So I'm going to place my hand, so my hand is facing towards the wall. I'm going to place my hand on the wall, and then imagine same thing, 100% that I'm trying to push the wall back. I'm just generating a 20% intensity, just holding that contraction for anywhere between 30 to 60 seconds, and then relax. Again, push, hold that contraction for 30 to 60 seconds, and then relax. Okay, so I would do this 2 times. So again, each contraction, anywhere between 30 to 60 seconds, take a break and do it again. So next exercise is called as the seated scapular setting. Okay, for this exercise, so imagine, so when I'm trying to, if I want to bring my shoulders close to my ears, I'm going to shrug it, right? But for this exercise, I want my shoulder away from the ears. So I'm going to depress, I'm going to bring my shoulder down. So instead of this, I'm doing this. So I'm doing this. So now, once I've done that, that's number 1 motion. And the next movement is I'm going to squeeze my shoulder blades together, and I'm going to hold this position for 5 seconds and then relax. Again, depress, squeeze, hold this for 5 seconds and then relax, okay? So let's look from the back, okay? Same thing. So we call this scapular depression. So I'm not shrugging it. So I'm bringing my shoulder down. So think about pressing something down like this, and then I'm going to squeeze my shoulder blades together and hold this for 5 seconds and then relax. Again, depress, so I'm pushing something down, and then I'm going to squeeze my shoulder blades together, hold this for 5 seconds, and then relax. Same thing, depress, squeeze, like shoulder blade squeeze, and then relax. Okay, so we'll do this exercise, 5-second hold, 5 times. So perform this routine daily. Once you start to feel better, then move on to phase 2. So welcome to phase 2. So we're going to stop using the stick and we're going to start moving against gravity. The first exercise is basically thoracic spine rotation. For this exercise, you're going to sit on a chair and you want to make sure that your hips are locked, so the movement is going to happen right at the upper back. So I'm going to fold my hand towards the chest, okay? And then I'm going to gently rotate the thoracic spine. The goal is not to force, but rather gently move the rotate the thoracic spine, and then come back to starting position. Again, gently move the thoracic spine, and then come back to the starting position. Again, gently rotate the thoracic spine. You're basically looking at your shoulders here, and then come back to starting position. Again, same thing, gently rotate the thoracic spine. So you're not trying to go all the way out. So again, don't force it, just let it move slowly, okay? So think about, like, greasing the groove in that upper back spine. And again, we talked about how thoracic spine mobility is very important for your shoulder health. So I would do anywhere between 5 to 10 repetitions on each side to complete this exercise. So the next exercise is called as the active scaption. So same exercise that we did in phase 1, except that this time we're not going to use our stick. We're going to start moving against gravity. So we're not using a stick to help with our to bring our injured shoulder up. So basically, you're sitting on a chair like this, okay? So remember, it's not here, it's not here, it's like a V, okay? So thumbs up and then slowly go up. Again, you might be able to go up here and you might have pain, and that's fine. So that's your range of motion today. But slowly, as you get better, you slowly go up, trying to reach up to like 90 degrees. Again, same cue. When you're trying to come here, if you have to shrug your shoulder to bring it up, that's not what we want to do. We want to keep our shoulders tucked back. So imagine you're pushing this the seat down. So you're keeping that shoulders tucked down as you start to bring your shoulder up. So again, I'm not shrugging my shoulder. I'm not doing this. My shoulder stays. My shoulder is away from the ears. It is not close to my ears. It is away from the ears as I complete this motion. Again, as I said, if you're only able to do it here, that's fine. The goal is to slowly go up, okay? So I would do this exercise anywhere between 10 to 20 repetitions, and then probably do 1 to 2 sets. So the next exercise is called as the supine serratus punch. For this exercise, you're going to lie on the floor like this. We're going to train the most important muscle, the serratus muscle, which is responsible for keeping that scapula, the shoulder blade, pushed to the rib cage. Because if it's not working properly, then the shoulder blade is going to tilt forward and thereby causing the impingement. So we want to strengthen that muscle. So I'm going to lie down, okay? And then I'm going to keep my elbows locked straight, okay? And if you want a fist, you can make a fist. It doesn't matter, but I like to make a fist here. So there are 2 ways to think about it. So one, you can think about like pushing so basically you're punching that ceiling up and then holding that contraction for 5 seconds and then slowly come back down. Again, punch and then slowly come back down. Again, punch, hold. So you should feel like almost like your shoulder blade is like, hugging that rib cage and then come back down. The other way to think about it is like almost giving a hug. So how do we give a hug? We just go and hug like this, right? So same thing, you're giving a hug and then hold that contraction for 5 seconds and then slowly come back down. Again, a good hug or a good punch and then hold that contraction for 5 seconds and then relax slowly, okay? So I would do this exercise anywhere between 8 to 10 repetitions, anywhere between 2 to 3 sets. So next exercise is called as the isometric walkouts. We're going to do both internal rotation and external rotation. For this exercise, you need a resistance band. So resistance band can come in various resistances. You can start with the light resistance and slowly build to heavy resistance band. This is going to be an isometric exercise still, but again, we're going to use a resistance, so it's going to be a little bit harder. So I'm going to show with a black band. Black resistance band is usually somewhere heavy or moderately heavy. So I've looped that resistance band on a door knob. And then what are you going to do? So either you can tie the resistance band in such a way that you're going to only hold one end of the resistance band, or you can hold just like how I hold kind of like both resistance bands together. So now I'm not pulling it away, rather I'm just holding that resistance band. I'm kind of walking away from the door, and now that resistance band is trying to pull me. Okay, so again, I'm walking out. Okay, and then I'm holding that contraction anywhere between 30 to 60 seconds. So you can see here, this resistance band is probably a little bit harder for me, because you can see my shoulder is almost going into rotation. So I can hold for 20 seconds or so, but your goal is to make sure that you're holding out right at this position, holding anywhere between 30 to 60 seconds. And once that 30 to 60 seconds is over, you don't let it kind of go. You just walk back towards the wall. Okay, then you do it on the other side, and then you take a break. So I would recommend doing 3 times on each side of your shoulder. So now that we have done external rotation, so we're going to do internal rotation. For internal rotation, the same thing. So I'm going to walk away from the wall like this. Okay, and now that band is pulling me this way. Okay, so I'm holding that. So I'm holding this muscle, my subscapularis muscle, part of the rotator cuff muscle, and probably I'm also firing my chest muscle as well. And I'm holding this contraction so that my band doesn't pull me towards the wall. And I hold this for anywhere between 30 to 60 seconds. You'll always find that this part, you're always stronger compared to the external rotation, and that's just normal. As you hold, and then you hold, once you finish holding the contraction for 30 to 60 seconds, then you walk towards the wall. You don't let the band take you back. You just walk towards the wall. Same thing again, I bring it back. Again, hold this contraction for 30 seconds and then go back. So next exercise is called as the prone extension. And we're going to focus on the scapular strengthening as well. So for this exercise, I'm going to do it on a prone position, but I'll show you a back view and a side view before I do the prone position view, basically where my face is going to face the floor. So let's start with the back. Okay, so for this exercise, so we're going to focus on 3 cues. Okay, so first cue is we're going to depress the shoulder. So when I say depress, so imagine this is shrugging the shoulder, so bringing the shoulder close to the ears. You want to focus on bringing the shoulder away from the ears. So I'm depressing it down. Okay, my hands are facing towards the wall now, and then similarly when I'm lying down, it'll be facing the floor. So now as I keep my shoulder down, I'm going to squeeze the shoulder blade. Okay, and then once that is done, that's the second cue. And the third cue is basically I'm lifting this shoulder up away from the floor, hold for anywhere between 3 to 5 seconds, and then bring it back down and then relax. Again, same thing, shoulder down, and then I'm going to squeeze my shoulder blade and then lift up and then hold that contraction for 3 to 5 seconds and then relax. Okay, again on the side view, so then the side view you can see my shoulder extension movement. So same thing, we're going to bring the shoulder down, okay, squeeze the shoulder blade and then lift the shoulder up like this, hold for 3 to 5 seconds and then bring back down. Okay, so now we're going to do this exercise facing the floor. So it's better to have a towel so that you know that you're going to, so that you can support your neck, and also knowing that you should not bring your neck up. So put the towel down on the floor, okay? And I'm going to put my head onto the towel so that I know that I should not be bringing my neck up when I do the exercise. So keep your head on the towel. So same thing, your hands are going to face the floor. So now, same thing, we're not shrugging, we're bringing the shoulder away from the ears and then squeeze the shoulder blade. Okay, still you can see my hand is in contact with the floor, and then
lift up and then hold 100, 200, 300, 400, 500, and then relax. Again, same thing, shoulder down, squeeze the shoulder blade, and then lift up 100, 200, 300, 400, 500, and then relax. Okay, so I would do anywhere between 6 to 10 repetitions, and I would recommend doing 2 to 3 sets. Okay, do these exercises daily. Once you're able to do phase 2 with zero sharp pain, then you're ready to start building some strength and building muscle. So when you feel like you're ready to move on, then you'll find the phase 3 and the phase 4 of the Rehab protocol here. I hope this video was helpful. If you find this video helpful, please make sure that you let me know in the comments below, and please hit the like button so this video can reach more people. And I'll see you in phase 3 and phase 4 when you're ready.